It's getting worse, everybody. It's getting worse. The drip. She directs here. For other uses, see drip disambiguation. Intravenous therapy, abbreviated as IV therapy, is a medical process that administers fluids, medications, and nutrients directly into a person's vein. The intravenous route of administration is commonly used for rehydration or to provide nutrients for those who cannot or will not, due to reduced mental states or otherwise, consume food or water by mouth. It may also be used to administer medications or other medical therapies such as blood products or electrolytes to correct electrolyte imbalances. Attempts at providing intravenous therapy have been recorded as early as the 1400s, but the practice did not become widespread until the 1900s after the development of techniques for safe, effective use. This is a picture of a person receiving medication through an intravenous line. The intravenous route is the fastest way to deliver medications and fluid replacement throughout the body, as they are introduced directly into the circulatory system, and thus quickly distributed. For this reason, the intravenous route of administration is also used for consumption of some recreational drugs. Many therapies are administered as a bolus or one-time dose, but they may also be administered as an extended infusion or drip. The act of administering a therapy intravenously or placing an intravenous line, IV line, for later use is a procedure which should only be performed by a skilled professional. The most basic intravenous access consists of a needle piercing the skin and entering a vein which is connected to a syringe or external tubing. This is used to administer the desired therapy. In cases where a patient is likely to receive many such interventions in a short period, with consequent risk of trauma to the vein, normal practice is to insert a cannula, which leaves one end in the vein, and subsequent therapies can be administered easily through the tubing at the other end. In some cases, multiple medications or therapies are administered through the same IV line. IV lines are classified as central lines if they end in a large vein close to the heart, or as peripheral lines if their output is to a small vein in the periphery, such as the arm. An IV line can be threaded through a peripheral vein to end near the heart, which is termed a peripherally inserted central catheter, or PICC line. If a person is likely to need long-term intravenous therapy, a medical port may be implanted to enable easier repeated access to the vein without having to pierce the vein repeatedly. A catheter can also be inserted into a central vein through the chest, which is known as a tunneled line. The specific type of catheter used and the site of insertion are affected by the desired substance to be administered and the health of the veins and the desired site of insertion. Placement of an IV line may cause pain, as it necessarily involves piercing the skin. Infections and inflammation, termed phlebitis. 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 Placement of phlebitis may be more likely if the same vein is used repeatedly for intravenous access, and can eventually develop into a hard cord which is unsuitable for IV access. The unintentional administration of a therapy outside of a vein, termed extravasation or infiltration, may cause other side effects. Intravenous IV access is used to administer medications and fluid replacement, which must be distributed throughout the body, especially when rapid distribution is desired. Another use of IV administration is the avoidance of first-pass metabolism in the liver. Substances that may be infused intravenously include volume expanders, blood-based products, blood substitutes, medications, and nutrition. Fluid solution. This is a farce. Fluids may be administered as part of a volume expansion or fluid replacement through the intravenous route. Volume expansion consists of the administration of fluid-based solutions or suspensions designed to target specific areas of the body which need more water. Speaking of. There are two main types of volume expander, crystalloids and colloids. Crystalloids are aqueous solutions of minerals, salts, or water-soluble molecules. Colloids contain larger insoluble molecules such as gelatin. Blood itself is considered a colloid. Most commonly, the most commonly used crystalloid fluid is a normal saline, a solution of sodium chloride at 0.9% concentration, which is isotonic with blood. What does isotonic mean? A solution is isotonic when its effective osmolar concentration is the same as that of another solution. In biology, the solutions on either side of the cell membrane are isotonic if the concentration of solutes outside the cell is equal to the concentration of solutes inside the cell. In this case, the cell neither swells nor shrinks because there is no concentration gradient to the induce the diffusion of large amounts of water because the cell water molecules regularly diffuse the plasma membrane in both directions, and the rate of water diffusion in the cell will never gain or lose water. Basically, it stays the same size and doesn't get or lose any water. So that's important because then it won't make your veins explode. Okay. Lactated ringers, also known as Ringer's lactate, and the closely related Ringer's acetate, are mildly hypotonic solutions often used in those who have significant burns. Colloids preserve a high colloid osmotic pressure in the blood, while on the other hand, this parameter is decreased by crystalloids due to hemodilution. Crystalloids are generally much cheaper than colloids. Buffer solutions, which are used to correct acidosis or alkalosis, are also administered through intravenous access. Lactated Ringer solution used as a fluid expander or base solution to which medications are added also has some buffering effect. Another solution administered intravenously as a buffering solution is a sodium bicarbonate. Medications may be mixed into the fluids mentioned above, commonly normal saline or dextrose solutions. Compared with other routes of administration, such as oral medications, the IV route is the fastest way to deliver fluids and medications throughout the body. For this reason, the IV route is commonly preferred in emergency situations or when a fast onset of action is desirable. An extremely high blood pressure termed a hypertensive emergency. IV antihypertensives may be given to quickly decrease the blood pressure in a controlled manner to prevent organ damage. In atrial fibrillation, IV amiodarone may be administered to attempt to restore normal heart rhythm. IV medications can also be used for chronic health conditions such as cancer, for which chemotherapy drugs are commonly administered intravenously. In some cases, such as vancomycin, or a loading or bolus dose of medicine is given before beginning a dosing regimen to more quickly increase the concentration of medication in the blood. The bioavailability of an IV medication is by definition 100%. What is bioavailability? Unlike oral administration, where medication may not be fully absorbed or may be metabolized prior to entering the bloodstream. For some medications, there is virtually zero oral bioavailability. For this reason, certain types of medication can only be given intravenously, as there is insufficient uptake by other routes of administration, such is the case of severe dehydration, where the patient is required to be treated via IV therapy for a quick recovery. The unpredictability of oral bioavailability in different people is also a reason for a medication to be administered intravenously, as with furosemide. Oral medications may also be less desirable if a person is nauseous or vomiting, or has severe diarrhea, as these may prevent the medicine from being fully absorbed from the gastrointestinal tract. In these cases, the medication may be given IV only until a patient can tolerate a normal form of the medication. The switch from IV to oral medication is usually performed as soon as viable, as there is generally cost and time savings over IV administration. Whether a medication can potentially be switched to an oral form is sometimes considered when choosing appropriate antibiotic therapy for use in a hospital setting. As a person is unlikely to be discharged, they still require IV therapy. Some medications, such as aprepitant, are chemically modified to be better suited for IV administration. What the fuck does that mean? What do you mean by that? Chemically modified? That's just how medicine is made. All medicine is chemically modified to be medicine. What the fuck do you mean? You're forming a prodrug. Such as phosphoripirant. This can be for pharmacokinetic reasons or to delay the effect of the drug until it can be metabolized into the active form. Blood product. Oh my god. No. Oh no. Blood products. A blood product, or blood-based product, is any component of blood which is collected from a donor for use in blood transfusion. Blood transfusions can be used in massive blood loss due to trauma, or can be used to replace blood loss during surgery. Blood transfusions may also be used to treat a severe anemia or thrombocytopenia caused by a blood disease. Early blood transfusions consisted of whole blood, but modern medical practice commonly uses only components of the blood, such as packed red blood cells, fresh frozen plasma, or cryoprecipitate. Nutrition. Parenteral nutrition is the act of providing required nutrients to a person through an intravenous line. This is used in people who are unable to get nutrients normally by eating and digesting food. A person receiving parenteral nutrition will be given an intravenous solution which may contain salts, dextrose, amino acids, lipids, and vitamins. The exact formulation of a parenteral nutrition used will depend on the specific nutritional needs of the person it is being given to. If a person is only receiving nutrition intravenously, it is called total parenteral nutrition, whereas a person is only receiving some of their nutrition intravenously is called partial parenteral nutrition. So wait. Theoretically, could you remove the need to shit? Because shit's getting rid of waste. But if you had an IV that only gave you exactly what you needed, and there was no waste, then you wouldn't need the shit. Groundbreaking. Medical imaging relies on being able to clearly distinguish internal parts of the body from each other. One way this is accomplished is through the administration of a contrast agent into a vein. The specific imaging technique being employed will determine the characteristics of an appropriate contrast agent to increase the visibility of blood cells, vessels, or other features. Common contrast agents are administered into a peripheral vein from which they are distributed throughout the circulation to the imaging site. Other uses. Uses in sports. IV rehydration was formerly a common technique for athletes. The World Anti-Doping Agency prohibits intravenous injection of more than 100 milliliters per 12 hours, except under a medical exemption. The United States Anti-Doping Agency notes that, as well as the dangers inherent in IV therapy. IVs can be used to change blood test results, such as hematocrit, where EPO or blood doping is being used, mask urine test results by dilution, or by administering prohibited substances in a way that will be more quickly be cleared from the body in order to beat an anti-doping test. Players suspended after attending boutique IV clinics with thought for this sort of treatment include footballer Samson Nassiri in 2017 and swimmer Ryan Lochte in 2018. Uses for hangover treatment. In the 1960s, John Myers developed the Myers cocktail, a non-prescription IV solution of vitamins and minerals marketed as a hangover cure and general wellness remedy. The first boutique IV clinic offering similar treatments opened in Tokyo in 2008. These clinics, whose target market was described by Ellie as health nuts who moonlight as heavy drinkers, have been publicized in the 2010s by glamorous celebrity customers. Intravenous therapy is also used in people with acute ethanol toxicity to correct electrolyte and vitamin deficiencies which arise from alcohol consumption. Oh. Others. In some countries, non-prescription intravenous glucose is used to improve a person's energy, but is not part of routine medical care in countries such as the United States, where glucose solutions are prescription drugs. Improperly administered intravenous glucose, called ringer, such as that which is administered clandestinely in storefront clinics, poses increased risks due to improper technique and oversight. Intravenous access is also sometimes used outside of a medical setting for the self-administration of recreational drugs such as heroin, fentanyl, cocaine, methamphetamine, DMT, and others. Intravenous therapy is also used for veterinary patient management. Bolus. Some medications can be administered as a bolus. This is just giving it once, okay? A bolus is once, okay? I don't need to read this whole thing. We read it earlier. Bolus is once. Infusion is over time. It's over time. On a schedule. Secondary. Any additional medication to be administered intravenously at the same time as an infusion may be connected to the primary tubing. This is termed a secondary IV or IV piggyback. This prevents the need for multiple IV access lines on the same person. When administering a secondary IV medication, the primary bag is held lower than the secondary bag so that the secondary medication can flow into the primary tubing rather than the fluid from the primary bag flowing into the secondary tubing. The fluid from the primary bag is needed to help push any remaining medication from the secondary IV from the tubing. If a bolus or secondary infusion is intended for administration in the same line as a primary infusion, the molecular compatibility of the solutions must be considered. Secondary compatibility is generally referred to as Y-site compatibility, named after the shape of the tubing, which has support for bolus administration. The incompatibility of two fluids of medication can arise due to issues of molecular stability, changes in solubility, or degradation of one of the medications. Bolus. Methods and equipment. The The simplest. Oh my fucking god. It's in. I'm gonna lose my. The simplest form of intravenous access is by passing a hollow needle through the skin directly into a vein. Wow! A syringe can be connected directly to this needle, which allows for a bolus dose to be administered. Wow! Alternatively, the needle may be placed and then connected to a length of tubing, allowing for an infusion to be administered. For some reason, the numbers 344 and 348. The type and location of venous access, i.e. a central line versus peripheral line, and in which vein the line is placed, can be affected by the potential for some medications to cause peripheral vasoconstriction, which limits circulation to peripheral veins. A peripheral cannula is the most common intravenous access method used in hospitals, pre-hospital care, and outpatient medicine. This may be placed in the arm, commonly either the wrist or the median cubital vein at the elbow. A tourniquet may be used to restrict the venous drainage of the pipe and make the vein bulge, making it easier to locate and place the line in the vein. When used, a tourniquet should be removed before injecting medication to prevent extravasculation. The part of the catheter that remains outside the skin is called the connecting hub. It can be connected to a syringe or an intravenous infusion line, or capped with a HEP lock or saline lock, a needleless connection filled with a small amount of heparin or saline solution to prevent clotting between uses of the catheter. Ported cannulae have an injection port on top that is often used to administer medicine. I'm not on anything right now. This is you need to know this, okay? Not at this moment. I'm not. Okay? I'm not. The thickness and size of the needles in catheters can be given in Birmingham gauge or French gauge. I'm gonna Why? Why is everything so complicated? A Birmingham gauge of 14 is a very large cannula used in resuscitation settings, and 24 to 26 is the smallest. The most common gauges are 16 gauge, the mid-sized line used for blood donation and transfusion, 18 and 20 gauge, all-purpose line for infusions and blood draws, and 22 gauge, all-purpose pediatric line. 12 and 14 gauge peripheral lines are capable of delivering large volumes of fluid very fast, accounting for their popularity in emergency medicine. These lines are frequently called large bores or trauma lines. I personally prefer 8-bore. Peripheral. Peripheral intravenous line is inserted in the peripheral veins, such as the veins in the arms, legs, and feet. Medication administered in this way travels in the vein to the heart, which the circulatory system. The size of the peripheral vein limits the amount of medication administered safely. A peripheral line consists of a short catheter inserted in the skin into the peripheral vein. This is usually in the form of cannula, utilized with This is usually in the form of a cannula over needle device in which a plastic cannula comes mounted over a metal trocar. Once the tip of the needle and cannula are placed, the cannula is advanced inside the vein over the trocar to the appropriate position and secured. The trocar is then withdrawn and discarded. Blood samples may also be drawn from the line directly after the initial IV cannula insertion. A central line is an access method in which a catheter empties into a larger, more central vein, a vein within the torso, usually the superior vena cava, inferior vena cava, or the right atrium of the heart. There are several types of intentional IV access categorized based on the route the catheter takes outside the body to the central vein input, output, output, output. A peripherally inserting central catheter, also called a PIC line, is a type of central IV access which consists of a cannula inserted through a sheath into a peripheral vein and then carefully fed towards the heart, terminating at the superior vena cava or the right atrium. These lines are usually placed in the peripheral veins in the arm and may be placed using the Seldinger technique for under ultrasound guidance. An X-ray is used to verify that the end of the cannula is in the right place. Fluoroscopy was not used during the insertion. An EKG can also be used in some cases to determine if the end of the cannula is in the correct location. A tunneled line is a type of central access which is inserted under the skin and then travels a significant distance through the surrounding tissue before reaching and penetrating the central vein. Using a tunneled line reduces the risk of infection as compared to other porous accesses. Bacteria from the skin surface are not able to travel directly into the vein. These catheters are often made of materials that resist infection and clotting. Types of tunneled central lines include the Hickman line or the Broviac catheter. A tunneled line is an option for long-term venous access necessary for hemodialysis in people with poor kidney function. An implanted port is a central line that does not have an external connector protruding from the skin for administration of medication. Instead, a port consists of a small reservoir covered in silicone rubber which is implanted under the skin, which then covers the reservoir. Medication is administered by injecting medication through the skin and the silicone port cover into the reservoir. When the needle is withdrawn, the reservoir cover reseals itself. A port cover is designed to function for hundreds of needle sticks during its lifetime. Ports may be placed in an arm or in the chest area. Brown's body light. Infusions. Equipment used to place and administer an IV line for infusion consists of a bag, usually hanging above the height of the person, and sterile tubing through which the medicine is administered in a basic gravity IV. The bag is simply hung above the height of the person, and the solution is pulled via gravity through a tube attached to a needle inserted into a vein. Without extra equipment, it is not possible to precisely control the rate of administration. For this reason, a setup may also incorporate a clamp to regulate flow. Some IV lines may be placed with Y sites, devices which enable a secondary solution to be administered through the same line, known as piggybacking. Some systems employ a drip chamber which prevents air from entering the bloodstream, causing air embolism, aka your blood explodes, and allows visual estimation of the flow rate of the solution. Alternatively, an infusion pump allows precise control over the flow rate and total amount delivered. A pump is programmed based on the number and size of infusions being administered to ensure all medicine is fully administered without allowing access to the access line to run dry. Pumps are primarily utilized when a constant flow rate is important, or when changes in rates of administration would have consequences. All the techniques. To reduce pain associated with the procedures, medical staff may apply a topical local anesthetic, such as EMLA or Ametop, to the skin of the chosen venipuncture area about 45 minutes beforehand. If the cannula is not inserted correctly where the vein is particularly fragile and ruptures, blood may extravasate into the thoracic tissues. This situation is known as a blown vein or tissuing. Using the cannula to administer medications causes extravasation of the drug, which can lead to edema, causing pain and tissue damage, and even necrosis, depending on the medication. And do not do it with chlorine trifluoride. That's not good. The person attempting to obtain the access must find a new access site proximal to the blown area to prevent extravasation of medications through the damaged vein. For this reason, it is advisable to site the first cannula at the most distal appropriate vein. I'm gonna do it. I'm gonna fucking do it. Adverse effects. Pain. Placement of an intravenous line inherently causes pain when the skin is broken is considered medically invasive. For this reason, when other forms of administration may suffice, intravenous therapy is usually not preferred. This includes the treatment of mild or moderate dehydration with oral rehydration therapy, which is an option, as opposed to peritoneal rehydration through an IV line. Children in emergency departments being treated for dehydration have better outcomes with oral treatment than intravenous therapy due to pain and complications of an intravenous line. Cold spray may decrease the pain of putting in an IV. The fuck? Holy shit, it's the shit from Metal Gear Solid 2. Certain medications also have specific sensations of pain associated with their administration IV. This includes potassium, which when administered IV intravenously can cause a burning or painful sensation. The incidence of side effects specific to a medication can be affected by the type of access, peripheral versus central, the rate of administration, or the quantity of drug administered. When when medications are administered too rapidly through an IV line, a set of vague symptoms such as redness or rash, fever, and others may occur. This is termed an infusion reaction and is prevented by decreasing the rate of administration of the medication. When vancomycin is involved, this is commonly termed a red man syndrome. After the rapid flushing, which occurs after rapid administration. Infection and inflammation. As placement of an intravenous line requires breaking the skin, there is risk of infection. Skin-dwelling organisms. man. Look, I'm having a bad fucking time right now. You don't have to be like that. Squid! Not squid. Skin-dwelling organisms such as may enter through the insertion site around the catheter, or bacteria may be accidentally introduced inside the catheter from contaminated equipment. Infection of an IV access site is usually local, causing easily visible swelling, redness, and fever. However, pathogens may also enter the bloodstream, causing which can be sudden and life-threatening. Bonk, bonk. A central IV line poses greater risk of sepsis as it can deliver bacteria directly into the central circulation. A line which has been in place for a longer period of time also increases the risk of infection. Inflammation of the vein may also occur. Where was I? Inflammation of the vein may also occur, called thrombophlebitis, or simply phlebitis. This may be caused by infection, the catheter itself, or the specific fluids or medication being given. Repeated instances of phlebitis can cause scar tissue to build up along a vein. A peripheral IV line cannot be left in the vein indefinitely out of concern for the risk of infection and phlebitis, among other potential complications. However, recent studies have found that there is no increased risk of complications in those whose IVs were replaced only when clinically indicated versus those whose IVs were replaced routinely. If placed with proper aseptic technique, it is not recommended to change a peripheral IV line more frequently than every 72 to 96 hours. Phlebitis is particularly common in intravenous drug users and those undergoing chemotherapy, and intravenous drug users undergoing chemotherapy, whose veins can become sclerotic and difficult to access over time, sometimes forming a hard, painful venous cord. The presence of a cord is a cause of discomfort and pain associated with IV therapy and makes it more difficult for an IV line to be placed, as the line cannot be placed in an area with a cord. Infiltration and extravasation. Infiltration occurs when a non-vescent IV fluid or medication enters the surrounding tissue as opposed to the desired vein. It may occur when the vein itself ruptures, when the vein is damaged during insertion of an intravascular access device, or from increased vein porosity. Infiltration may also occur if the puncture of the vein by the needle becomes the path of least resistance, such as a cannula which has been left inserted, causing the vein to scar. It can also occur upon insertion of an IV line if a tourniquet is not promptly removed. Infiltration is characterized by coolness and pallor to the skin, as well as localized swelling or edema. It is treated by removing the intravenous line and elevating the affected limb so the collected fluids drain away. Injections of hyaluronidase around the area can be used to speed the dispersal of the fluid/drug. Infiltration is one of the most common adverse effects of IV therapy and is usually not serious unless it is. Others. If solutions administered are colder than the temperature of the body, induced hypothermia can occur. If the temperature change to the heart is rapid, ventricular fibrillation may result. If a solution which is not balanced in concentration is administered, a person's electrolytes may become imbalanced. In hospitals, regular blood tests may be used to proactively monitor electrolyte levels. If the solution used in the intravenous drip happens to be very acidic and or incendiary, bad things happen. History. Hold on, I need to take. I need to. I'll be back. The first recorded attempt at administering a therapeutic substance via IV injection was in 1492 when Pope Innocent the fucking 88th fell ill and was administered blood from healthy individuals. If this occurred, treatment did not work and resulted in the death of the donors while not healing the Pope. The story is disputed by some who claim that the idea of blood transfusions could not have been considered by medical professionals at the time, or that a complete description of blood circulation was not published until over 100 years later. This story is attributed to potential errors in translations of documents at the time, as well as potentially an intentional fabrication, whereas others still consider it to be accurate. One of the leading medical history textbooks for medical and nursing students claimed that the entire story was an anti-Semitic fabrication. In 1656, Sir Christopher Wren and Robert Boyle worked on the subject. As stated by Wren, I have injected wine and ale in a living dog into the mass of blood by a vein in good quantities until I have made him extremely drunk, but soon after he pisseth it out. The dog survived, grew fat, and was later stolen from his owner. Boyle attributed authorship to Wren. Richard Lower showed it was possible for blood to be transfused from animal to animal and from animal to man intravenously. A xenotransfusion. He worked with Edmund King to transfuse sheep's blood into a man who was mentally ill. Lower was interested in advancing science, but also believed that the man could be helped, either by the infusion of fresh blood or by the removal of old blood. It was difficult to find people who would agree to be transfused, but an eccentric scholar, Arthur Cogga, consented, and the procedure was carried out by Lower and the King before the Royal Society on the 23rd of November, 1667. Transfusion gathered some popularity in France and Italy, but medical and theological debates arose, resulting in transfusion being prohibited in France. There is virtually no recorded success of any of the attempts at injection therapy until the 1800s, when in 1831, Thomas Latta studied the use of IV replacements for cholera treatment. The first solutions, which saw widespread use for IV injections, were simple saline-like solutions, which were followed by experience with various other liquids, including milk, sugar, honey, and egg yolk. Fucking. In the 1830s, James Blundell, an English obstetrician, used intravenous administration of blood to treat women bleeding profusely during or after delivery. This predated the understanding of blood type, leading to unpredictable results. Holy fuck. Intravenous therapy was expanded by Italian physicist Guido Barcelli in the late 1890s, and further developed in the 1930s by Samuel Hirschfeld, Harold T. Hyman, and Justine Johnstone Wanger, but was not widely available until the 1950s. There was a time, roughly the 1910s to the 1920s, when fluid replacements that today would be done intravenously was likely to be done with a Murphy a rectal infusion. And IV therapy took years to increasingly displace that route. In the 1960s, the concept of providing a person's complete nutritional needs through an IV solution began to be seriously considered. The first parenteral nutrition supplementation consisted of hydrolyzed proteins and dextrose. This was followed in 1975 with the introduction of intravenous fat emulsions and vitamins added to form total parenteral nutrition, which includes protein, fat, and carbohydrates. Bottoms, take note. Banana bag, what the fuck? Well, I almost did something untoward, but I did not. I will see you. I do see you.